Okay, it's that time again. So, here is what we're going to talk about today: physician medical weight loss training. So, I'm just going to share some information that I have wrote down. So, biochemistry of the obese is different. So, what this means is that even after weight loss, the biochemistry of the formerly obese person is different than a person who never gained weight. So, it's no longer really an issue of willpower. So the money spent on weight loss treatments is about $60 billion a year. However, the cost of obesity in society is 147 to $210 billion a year. And just so everyone is aware, only 2% of diets are successful. There's also a study that shows the amount of sleep in correlation to obesity rates. So, those that slept less than 6 hours had a 27% increase of the rate of obesity, and those who had 5 hours or less have a 73% chance of obesity. So, we've all heard the benefits of exercise, that it's the most important thing for us to do for weight loss. Well, actually, studies have shown that exercise is most beneficial for weight loss maintenance than it is for initial weight loss. So, as an obese person begins the exercise regimen, it actually takes more and more exercise to maintain the weight loss. So, as many of my clients will tell you, I always recommend walking at an incline. It's the best exercise that you can do, and then slowly work your way up from where you originally start, and then eventually you can start adding weights like soup cans. You don't have to join a gym, you don't need to go to CrossFit or anything like that. I also talk about water intake. So I tell every one of my clients you should be drinking half your weight in ounces in water a day. So if you weigh 200 pounds, you should be drinking 100 ounces of water a day. There's also a couple little tricks that you can do. So, walking for a flat stomach, and I am going to refer to my paper for this. So, walk downhill with small, fast steps. Your stomach in, your shoulders straight, and make sure that your steps are as small as possible and very fast. Now, if you want shapely thighs, walk uphill with long steps without bending your knees, stomach in, shoulders straight, and that will help shape your hips. Now, for slimmer arms, swing your arms freely as you walk. So feel the pressure in your upper arms and as you stretch your arms back and forth. And for a slim waistline, walk at a medium pace with your hands held high in the air above your head. And keep your hands straight and maintain a perfect posture as you walk. Now, there are other things that you can do, like intermittent fasting. You can see a provider like me who helps with adding things to your lifestyle to help with those lifestyle changes. So there's the HCG, which was very, very popular for a long time. There's the semaglutide. There's the tirzepatide. There's phentermine, naltrexone, bupironate that you can add to your weight loss journey. So with intermittent fasting, you can do it several different ways. So you can do the 16-8 method, which means that you fast for 16 hours and then you have that 8-hour window to eat. And you can choose any 8-hour window that you want to consume the calories. So most people really do opt to skip breakfast for this diet, and others, they prefer to do like a 9 to 5 schedule. Now you can do the 5-2 diet. Now this is 5 days a week. You eat normally and then you don't restrict your calories. However, the other 2 days a week, you reduce your calorie intake to 500 calories per day. You can also do the alternative day fasting or the warrior diet. There are some people who like to do the paleo diet, which is often referred to as the caveman or the Stone Age diet, which is fruits, nuts, berries, that type of food. Now, the paleo diet does have good results at 6 months, but not at 24 months. So keep that in mind if that's the diet plan you choose to use. Now, the Mediterranean diet is the one that is liked most by physicians and providers because it's very heart healthy for you. You also have the people who like to do low calorie diets where they're eating less than 800 calories a day, which is not safe and I do not recommend it. You also have the popular keto diet, which is protein and fats with carbs almost non-existent. Now, there is some research that I have that the potential risks for this are kidney failure and stones, gout, osteoporosis. You do have rapid weight loss initially. However, there's a big loss of sodium. You also have the low-fat diets, which they're normally impossible to adhere to. So one of the first meds I'm going to talk about is phentermine. So the overall weight loss that was seen with this at the end of 30 weeks is approximately 13% of total body weight lost. But most studies are short term, and that shows like a 5 to 10% body fat loss. Many people will tell you that one of the side effects that they don't like of this is the jitteriness that they have, and they feel like they're on speed, their heart is racing, and they feel like they're having heart palpitations. There's also studies that show the best way to lose weight with phentermine is 1 month on, 1 month off for 9 months. Another one of the meds that I prescribed is bupirenone, and this was actually approved for depression and quitting smoking. However, those that take it for weight loss have seen 6.21% of weight loss after 8 weeks. There is a black box warning with this medication. Another medication is topiramate. Now, topiramate helps you feel less hungry or full faster. Topiramate can be combined with phentermine for increased weight loss, but there is a black box warning with this one for cleft palate. You can also use metformin as a way to lose weight, and this is acceptable in children at the age of 10 if they are struggling with weight loss as well. They've also shown that the use of metformin can help prevent the development of type 2 diabetes. The next combination is called Contrave, which is naltrexone and bupirenone together, and this treats drug and alcohol dependence. So if you are a casual drinker or any drinker of any kind, I do not recommend using this medication to help with weight loss, because if you do have a drink, you're going to feel really, really sick. So I always ask my clients if they like to drink even socially, and if they do, this is one medication that I don't even consider putting them on. But with this, the weight loss was 11.5%. You can also do phentermine and topiramate together as a weight loss option, and the weight loss seen with this was 14.7%. Now we're going to get into the injectables. So semaglutide, also known as Wegovy. The medication that I use is a compounded medication, and I let all of my clients know that. And it is a once weekly injection subcutaneously that you can give in the arm, the stomach, or the thighs. Now, I always recommend to my clients the thighs because for some reason, I'm not sure why, there seems to be a lot less side effects. And as many people who take this medication will tell you, the side effects are lovely. So nausea, vomiting, diarrhea, constipation. You also get heartburn, indigestion, and there are some more serious side effects. But most of the people who take this medication have nausea, and it can range from a couple hours after you inject yourself up to 48 hours after you've taken the medication. Tirzepatide, which is also called Mounjaro, is another injectable that is done once weekly. With both of these medications, there is greater weight loss that is seen. With the semaglutide, the weight loss is anywhere between 10 to 20% of your total body weight and fat. And with the Mounjaro, it's a little higher. It's up to 27% total body fat. Now on to what I call the fun part of it. So when you come see me as a client, I do a head-to-toe assessment, I calculate your BMI, I determine what dose that you need to be on. And I'm not a provider that you're just gonna come in, get a shot, and then go pay. That's not how it works, and that's not how it should work for anybody. So just be aware that there are certain things that you need to make sure that the provider you are seeing is going to do for you. And I am going to continue those on a second video.